Health workers at Kharkiv Regional Clinical Infectious Disease Hospital continue to treat virus patients despite the ongoing conflict. Air raid sirens go off multiple times a day, forcing the ill and weakened patients to be rushed down into the makeshift bomb shelter. According to the hospital's director, Dr. Pavel Nartov, handling ICU patients that are on ventilators is the most difficult and dangerous part of the process. But also, it is the most crucial given the dangers of exposing oxygen tanks to bombings and shrapnel.
Мы спускаемся сюда несколько раз в течение дня. Чаще всего это происходит вечером, но когда происходит воздушная тревога, слышны бомбежки, мы днем тоже даже сюда спускаемся.
Fewer COVID-19 patients were treated since the beginning of the Russian military operation due to the refugee exodus. Alongside Kiev, the eastern city of Kharkiv had been an epicenter of infections during the various waves of the pandemic. Daily COVID-19 cases across Ukraine reached around 40,000 in mid-February this year, but were on a steady decline after the Russian forces rolled across the border on February 24th. The WHO is particularly concerned by the low rate of vaccination against COVID-19 in Ukraine before the outbreak of war.
And for Ukrainians, it represents a specific risk because of their low vaccination uptake for COVID-19. 34% of the population, adult population, has completed their vaccination series. Only 1/3 of over 60s have. So these populations are at especially high risk of severe COVID-19, and we need to focus on protecting them from us, but also themselves.
WHO has commended Ukraine for maintaining its surveillance of the virus where possible, but health services, especially hospitals in the country, will be stretched.